Welcome to our lesson on first aid techniques specifically tailored for barbershop environments. Whether you're a seasoned professional or just starting out, knowing how to respond to emergencies is crucial for the safety and well-being of your clients. In this video, we'll explore common situations such as bleeding, burns, choking, fainting, and eye injuries. These incidents can happen unexpectedly, and your quick response can make a significant difference. Let's begin by understanding why first aid knowledge is a fundamental part of your professional responsibilities and how it ties into client safety and protection. Have you ever performed first aid techniques in your barbershop? The safety, protection, and welfare of your clients are the primary reasons you are licensed as a professional. Being prepared for emergencies not only demonstrates your commitment to client care but also builds trust and confidence. In this scene, we'll discuss how first aid skills empower you to act swiftly and responsibly, ensuring that your clients are in safe hands. Let's explore the core reasons why first aid is an essential part of your daily practice. At the end of this lesson, you'll be able to state first aid techniques for bleeding and wounds, identify methods for treating chemical and heat or electrical burns, describe procedures for choking and fainting, and explain how to handle eye injuries. These skills are vital for maintaining a safe environment in your barbershop. We'll break down each topic, providing clear steps and practical advice so you can confidently respond to any emergency. Let's dive into the specifics of each first aid scenario. Good Samaritan laws encourage people to help others in emergency situations by providing legal protection to those who offer emergency care. These laws require that helpers use common sense and act responsibly. Understanding these laws is important for barbershop professionals, as it reassures you that your efforts to assist clients in emergencies are supported by legal safeguards. Let's look at how these laws apply in practice and what you should keep in mind when providing first aid. Bleeding and wounds are common emergencies in barbershops. The first step is to place a clean cloth or gauze and a gloved hand over the wound, applying firm pressure for at least 5 minutes. If the bleeding is severe, call 911 immediately. Elevate the injured arm or leg above the victim's heart if possible. Once the bleeding stops, secure the cloth with a bandage, ensuring it's not too tight. Avoid lifting the cloth to check if bleeding has stopped, and never use a tourniquet unless absolutely necessary. These steps help control bleeding and protect the wound. Burns in the barbershop can occur from chemicals, heat, or electrical sources. Recognizing the type of burn is the first step in providing effective first aid. Chemical burns result from exposure to harsh substances, while heat or electrical burns are caused by contact with hot tools or electrical accidents. Each type requires a specific approach to treatment, which we'll cover in the next scenes. Understanding the differences ensures you respond appropriately and minimize further injury. When dealing with chemical burns, it's important to act quickly. Begin by rinsing away all traces of chemicals while removing any contaminated clothing from the burn area. Cover the burn loosely with a clean, dry cloth to protect it from further exposure. If necessary, refer the person to medical personnel for additional care. Prompt action can prevent complications and promote healing, so always be prepared to respond to chemical burn incidents in your barbershop. For heat or electrical burns, if the skin is not broken, immerse the area in cool water or gently apply a cool compress. Bandage with a clean, dry cloth. Do not break any blisters that form and avoid applying ointments or creams. If the skin is broken or the burn is severe, call 911 or other emergency personnel. Do not attempt to clean the burn, instead cover it loosely and wait for professional help. These steps help prevent infection and further damage. Choking is a serious emergency that requires immediate action. First, determine if the victim can talk or cough. If not, have someone call 911 while you give the victim abdominal thrusts. Stand behind the victim and wrap your arms around their stomach. Make a thumbless fist with one hand, placing it just above the navel and below the ribs, with the thumb and forefinger side toward the victim. Perform an upward abdominal thrust by grasping your fist with the other hand and pulling it quickly toward you. These steps can help dislodge the obstruction and restore breathing. If a client faints, lay them down on their back and ensure plenty of fresh air. Reassure the victim and apply a cold compress to their face. If the victim vomits, roll them onto their side to keep the windpipe clear. If the victim does not regain consciousness, call 911 immediately. These steps help stabilize the victim and prevent further complications. Knowing how to respond to fainting incidents is essential for maintaining a safe barbershop environment. Eye injuries in the barbershop fall into two main categories: chemical injuries and those caused by cuts, scratches, or embedded objects. Each type requires a specific first aid approach to prevent further damage and ensure proper care. In the following scenes, we'll break down the steps for treating each type of eye injury so you're prepared to act quickly and effectively. For chemical eye injuries, hold the eyelids apart and flush the eyeball with lukewarm water for 15 to 30 minutes. Make sure the runoff does not flow into the other eye. Place a gauze pad or cloth over both eyes and secure it with a bandage. Get to an eye specialist or emergency room immediately. prompt and thorough rinsing is critical to minimize damage and preserve vision. For eye injuries caused by cuts, scratches, or embedded objects, place a gauze pad or cloth over both eyes and secure it with a bandage. Do not attempt to remove embedded objects. Get to an eye specialist or emergency room immediately. These steps help protect the eye from further injury and ensure that professional medical care is provided as soon as possible. Safety data sheets, or SDS, provide information on the contents of products used in the barbershop. These sheets can be helpful if an allergic reaction or injury occurs, as they detail the ingredients and potential hazards. Keeping SDS accessible ensures you can quickly reference important information during emergencies and provide accurate details to medical personnel if needed. To affirm your understanding of key points, it's important to regularly check your knowledge. Reviewing questions about first aid techniques helps reinforce learning and ensures you're prepared to respond confidently in emergencies. In this scene, we'll highlight the importance of self-assessment and continuous improvement in your first aid skills. Continuing to check your knowledge ensures that you retain important first aid information. Regular review of procedures for bleeding, burns, choking, fainting, and eye injuries keeps your skills sharp and ready for action. Let's emphasize the value of ongoing learning and practice in maintaining a safe barbershop environment. Validating your learning is an important step in mastering first aid techniques. Celebrate the progress you've made and recognize the value of your new skills. This scene encourages you to take pride in your ability to protect clients and respond effectively to emergencies. Let's acknowledge the dedication and effort you've invested in becoming a safer, more responsible professional. Continuing to validate your learning helps reinforce your confidence and competence in first aid. By celebrating what you've learned, you build a positive mindset that encourages ongoing growth and improvement. This scene highlights the importance of recognizing your achievements and staying motivated to keep your skills up to date. Celebrating your skills is a great way to stay motivated and committed to client safety. Recognize the progress you've made in mastering first aid techniques and take pride in your ability to respond to emergencies. This scene encourages you to continue learning and improving, ensuring that your barbershop remains a safe and welcoming environment for everyone. Validating your skills is an ongoing process that ensures you're always ready to handle emergencies. Regular practice and review of first aid techniques help maintain your confidence and effectiveness. This scene emphasizes the importance of continuous learning and the role it plays in keeping your barbershop safe for clients and staff alike. Continuous improvement is key to maintaining high standards of safety in your barbershop. By regularly updating your knowledge and practicing first aid techniques, you ensure that you're always prepared for emergencies. This scene encourages you to embrace lifelong learning and strive for excellence in client care and safety. Let's summarize the key points covered in this lesson. We discussed first aid techniques for bleeding and wounds, burns, choking, fainting, and eye injuries. Understanding Good Samaritan laws, the importance of safety data sheets, and the value of continuous learning are all essential for maintaining a safe barbershop environment. Take these skills forward and continue to practice and improve, ensuring the safety and well-being of your clients every day. First aid refers to the immediate care given to someone who has been injured or is suddenly taken ill. The goal is to preserve life, prevent further harm, and promote recovery until professional medical help arrives. In the barbershop, first aid knowledge is a core competency that ensures client safety and builds trust in your professional abilities. Controlling bleeding is a fundamental first aid skill. It involves applying pressure to the wound, elevating the affected limb, and securing the area with a bandage. The aim is to minimize blood loss and prevent shock. Understanding when to call for emergency help and avoiding unnecessary interventions, such as tourniquets, is crucial for effective bleeding control. Burns are injuries caused by heat, chemicals, or electricity. First aid for burns focuses on cooling the affected area, protecting it from infection, and seeking medical help when necessary. Recognizing the type and severity of burn guides your response and ensures the best outcome for the injured person. Choking occurs when an object blocks the airway, preventing normal breathing. The abdominal thrust technique, also known as the Heimlich maneuver, is used to dislodge the obstruction. Quick recognition and action are vital to prevent serious consequences and restore breathing. Fainting is a temporary loss of consciousness caused by reduced blood flow to the brain. First aid involves laying the victim down, ensuring fresh air, and monitoring their condition. Prompt care helps prevent complications and supports recovery. Eye injuries can result from chemicals, cuts, scratches, or embedded objects. First aid focuses on protecting the eye, preventing further damage, and seeking professional medical care. Immediate and appropriate action is essential to preserve vision and minimize complications. Good Samaritan laws provide legal protection to individuals who assist others in emergencies. These laws encourage responsible action and ensure that helpers are not penalized for their efforts. Understanding these laws gives barbershop professionals confidence to act in the best interest of their clients. Safety data sheets, SDS, are documents that provide detailed information about the contents and hazards of products used in the barbershop. They are essential for managing chemical safety and responding to allergic reactions or injuries. Keeping SDS accessible supports safe practices and informed emergency responses.